Hey, it's Brian from Flagstaff. Just want to talk to you today about how to fix plantar foot pain, also known as the pain that you get on the bottom of your foot. A lot of times runners get it and it can shut runners down for months or years if it's not treated appropriately. So let's get to the bottom of it. I'm going to talk about how I treat runners with that pain on the bottom of their foot. The first, and I think the most important thing, is diagnosis. We got to get this thing diagnosed correctly because there's actually a lot of structures on the bottom of your foot and they're all treated a little bit different. You'll probably have heard the term plantar fasciitis, and that term refers to the fascia on the bottom of the foot being painful. Other things that can be painful are muscles. There's a number of different muscles on the bottom of your foot, as well as nerves. There's nerves that run all the way through the bottom of your foot to your toes. And then there's a fat pad on your calcaneus that absorbs force. Those are some of the 4 key things that can be hurt when you have pain on the bottom of your foot, and we treat them differently. I actually find that the muscles are hurt much more often and more frequently in runners than the fascia itself. So the term plantar fasciitis is a bit of a misnomer. And that's good news because muscles respond beautifully and quickly to treatment, but only the right treatment. So let's get to that. The goal of treatment, no matter which of these tissues it is first decrease the load to that tissue. If we decrease the load, decrease the force, then that tissue is going to start feeling better. It's going to stop kicking you with pain signals. Number 2 is we want to get rid of that pain and start a healing response. So we want to get the pain down so it's not bugging you so often, and then we want to get that tissue to start to heal. And number 3, we want to find the cause, the root cause of why this problem started in the first place, and we want to fix it. So I know that sounds like really basic, but it's often overlooked, and that's why this problem and the pain in the bottom of your foot can last for so long. Some of the causes that we might look into addressing are a muscle imbalance, a restricted joint, or a gait or a movement fault. You're moving funny, and we can clean that up, and your bottom of your foot's going to feel a lot better. So if you were to come see me at Evolve Flagstaff, day 1, here's what we do. First, a detailed exam and movement analysis. We want to get to the bottom of what's hurting, we want to diagnose it, and we want to figure out why, get to that cause. Number 2, we want to knock that pain out, cut it down as much as we can. 80 to 100% the first visit is what I go for with that pain in the bottom of your foot. We do that with manual therapy, that's hands-on stuff that can really make a big difference in pain and promote a healing response. And then joint mobilizations to get the foot moving well so you stop hammering into that injured tissue. Number 3, we want to decrease load to that injured tissue while you continue to run. I don't like to shut runners down and tell them to stop running because then we don't know if we're fixing the problem. So I'm going to have you keep running your normal routine, but we're going to try to change the load to see if we can make it feel better, and we usually can. We do that with taping, muscle activation, and then some subtle gait or movement cues. So the combination of these things mean that in just the first visit, the bottom of your foot is going to be feeling a ton better, and you can usually keep running. What can you do now if you don't want to come in quite yet? And that's totally fine. Number 1 is a gentle self-massage using a tennis ball. And I'm going to emphasize gentle. If you're a runner, you know what I mean. You like to hammer away at everything, and you're probably going away at your bottom of your foot with tennis balls, with lacrosse balls. The harder the better. None of that, because you're probably only doing more damage and sensitizing that tissue further. Sure, it might feel good in the short term, but in the long run, you're going to get a rebound response that's going to increase your pain cycle. So go gentle with a soft tennis ball. The other thing is you got to go 10-15 minutes or more. Just rolling a couple times across. Again, that might feel good, but it's not going to make a big difference. We want to change that tissue, bring blood flow to it, make it more pliable. So you got to go gentle, but you got to go long. Number 2, some running cues. Try shorter, quicker strides and try to land soft, as if you're trying to sneak up on somebody while you're running. They shouldn't hear you coming. Those 2 cues have been shown to reduce the force through your leg and your foot when you land, and that's critical to letting those tissues heal. Try those 2 and see if they feel better. If they don't feel better, then you might need to come in and get a better diagnosis so we can really figure out what's going on. Because of that, we do offer free 15-minute phone consults, so we can talk, we can chat, we can figure out if you're a good fit for Evolve Flagstaff. We can talk about things you've tried, things that haven't worked, and really try to get a plan in place so that way you can get back to running pain-free. Cool, that's how I treat the pain on the bottom of your foot. Hit me up with questions in the comments or shoot me a message. Thanks.